Good afternoon. Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, where life becomes better living. And the proud author of Live Longer and Eat Better, that contains 36 foods for long life, now available on Amazon, as well as at Barnes & Noble stores for order, and online with the Kindle. Today's topic is going to be on tongue diagnosis. Now, most of us humans have a tongue, and the tongue has been used for thousands of years in ancient medical wisdom to help diagnose accurately an individual's pathologies. And so the tongue, I can show you right here, has in the front of the tongue is the heart and the lungs, according to most tongue grafts. The sides of the tongues, this is just somebody's sample tongue graft, but the sides of the tongue, this is very atypical, very standardized in our textbooks, is a side of liver and gallbladder. The back of the tongue typically represents the health and vitality of the intestines and the kidney. And the middle of the tongue often is representative of our digestive tracts, such as the pancreas, the spleen, and the stomach. So, how does this help? Well, it can help a lot. So what happens is we could be looking at a patient, and if the tip of their tongue is really red, then we're going to notice that they have a lot of heat in either their heart or their lungs. What does that mean? So that means that meridian pathway, the heart organ system, or the lung organ system, or the actual organ itself has too much excess. So that person might have anything from anxiety to elevated blood pressure to palpitations to vivid dreams to excess sadness because of a traumatic death of someone they loved. It could be all kinds of emotional, physical, viable, calculable, reportable, evidential things going on with this person along those lines. So a red tip of a tongue would be indicative of that. Or they could just be a student, studying so much they're just anxious from so much studying. So there's a wide variety of causes, but the point being is the tongue is a framework that's extremely accurate in giving more than a high-level overview of diagnostics. So a normal, healthy tongue is sort of like a pinkish reddish color, and it does not typically have any fissures in it or crackles in it or cracks in it. It's just a fairly thin, non-swollen bodied tongue that looks a little bit like this here. Now, as you can see, people have very many different types of tongues, okay? And that is just a couple. So when people do have a slippery tongue, a lot of extra fluid in their mouth, that's indicative a lot of times they may be really tired. It would be a question we would ask based on our training as acupuncture physicians. They may have a crack or the tongue might be very, very pale, like this one. See how that tongue there is like very swollen and sort of pale? This one's much darker and it has a thin line in the middle. Now, there's other tongues that show a lot of teeth marks in them. That's indicative of a weaker digestive system. If the tongue is swollen, there's a lot of teeth marks. That person commonly is tired and they have digestive issues, maybe bloating, so forth. Then there's people that have tongues like this with a big, pretty thick crevice or fissure all the way to the end. That's commonly indicative of a problem with the heart. It goes all the way to the end. It's a warning sign and or a confirmation of a heart pathology. So the beauty of this medicine and tongue diagnosis is it can provide a warning sign and or a treatment methodology as part of our diagnostic system. So Dr. Liz here, Doctor of Acupuncture and Oriental Medicine, checking in where life becomes better living, and just informing you folks, providing TCM tidbits so we can all take a look at our tongue and keep an eye on that. Take a trip to our acupuncturist or our doctor of acupuncture and oriental medicine in your area so you can get a tongue and pulse evaluation and a treatment plan to help you live optimally. Make it a great day. Dr. Liz and Jusqu'au Domaine.